Welcome back to Today's Health. In this segment, we're going to talk about umbilical hernias with Dr. Zubin Bhesania. Doctor, can you describe for us what is an umbilical hernia?
Well, umbilical hernia is essentially a hole of the abdominal wall at the umbilicus. So it's at the belly button.
And what causes an umbilical hernia?
In utero, the umbilical cord is attached to a baby at the umbilicus, and when a child is born, the umbilical stump scars over. And sometimes there's a congenital weakness at that area. Over time, though, adults can develop an umbilical hernia because the area is weakened, and anytime you have increased abdominal pressure, straining, coughing, heavy lifting, obesity, will put pressure at that site, which will cause a hernia.
Now, what are the symptoms of an umbilical hernia?
Typically, people will complain of a mass, a lump, or pain.
Who is most at risk for developing this type of hernia?
So you can be born with it, and that can create a hernia. You can also develop it with straining, anything that increases intra-abdominal pressure. So pregnancies, obesity, coughing, heavy lifting can create an umbilical hernia.
Is it helpful to have, build up kind of the core strength? Does that help protect against hernias?
Yes, because if you strengthen that area, you will be able to do more, and so normal lifting won't bother you.
What are the treatment options for an umbilical hernia?
So umbilical hernias are fixed as we fix inguinal hernias or incisional hernias. We're done in an open technique or a laparoscopic or robotic technique.
Doctor, can you explain what happens during the procedure to surgically repair a hernia?
Sure. We'll talk about the open technique first. So when we find an umbilical hernia and we're going to repair it in the open technique, what that means is we make an incision at the hernia, we'll dissect the hernia free, and we'll actually close the defect with some sutures, and then sometimes we'll put a piece of mesh on top of that to help strengthen it, and then close the skin. So in an open technique, we are making an incision to repair the hernia. Now, if we do it robotically or laparoscopically, we typically will make the incisions away from the hernia, and we will place our plastic sleeves that go through the abdominal wall on the left side of the abdomen. We'll visualize the hernia with a camera on the inside, and with the robot we're able to suture the defect closed, and then we'll place a piece of mesh. It's a special mesh that goes in the abdominal cavity, and we buttress the repair by suturing the mesh around the repair.
And again, the recovery time for the robotic assisted surgery is much less than for an open procedure.
Correct. So the minimally invasive procedures have a faster recovery. So we have smaller incisions, less risk for wound complications, and faster return to work.
Doctor, this is great information. It's time for another break. We'll continue in a moment.